Darla. I'm a family nurse practitioner with United States University. Today is 10/21/2024. Can you tell me your name and your birthday?
Mackenzie Alton, 7/16/92.
Okay, and then so we're going to be doing a musculoskeletal exam. Do I have your consent to do that exam?
Mm-hmm.
And then do I have your consent to record and upload this video to YouTube as an unlisted video for my professor to grade?
Yep.
Okay. And then I washed my hands and did all my hand hygiene. We're going to do a 360 of the room. So first, are we having any, do you have any pain, musculoskeletal pain, joint pain?
No.
No chronic pain that you deal with?
No.
Okay, so first we're going to inspect the hands and the fingers. So we're looking for symmetry. Are they equal? There's no noticeable nodules, there's no discoloration, and there's no swelling or fluid that I see. So then we're going to go palpating. We're going to start with our distal metaphalangeal joint, interphalangeal joints, and work our way proximal into our metacarpal phalangeal joint. And then as we're palpating, we're notice if there's any crepitus or any fluid building up in these joints, any pain, any swelling, any nodules, or if there's any warmth or heat or pain when we palpate. Nope. Okay. And then we're going to do our range of motion for our fingers and hands. So what we can do is have our patient make a fist, okay, and then fingers out, and we are going to flex our fingers up and flex our fingers down. And then we can also test with, this is active and passive range of motion too, and kind of do this for our patient as well, okay. And then for abduction and adduction, we're going to spread your fingers and put them together. Okay, perfect. Then we're going to do our wrists. Again, we're noticing the symmetry of her wrists, any atrophy, any nodules, deformities, discoloration, or swelling that's noticeable, which I don't see any. Then what we're going to do is palpate. We can palpate our metacarsal, metatarsals, and then if we're noticing any crepitus or any fluid, swelling or pain, no, and then our nodules here. And then for our range of motion, what we're going to do for, extension, up, flexation, and then abduction and adduction, and those are testing for our radial and ulnar deviation, which I don't see that there's anything like that. Do you have any issues with carpal tunnel syndrome?
No.
Okay, so how we're going to test for that, we're going to do two tests. The first test is our teenius sign. So how we're going to do that is we'll take one wrist and we're going to hyperflexate the wrist, and using the middle finger, I'm going to tap the medial nerve. Are you having any pain, numbness, tingling into the palm of your hand? Okay. And then the same over here. Nope. And then our next test is our Flannan test. So I'm going to have you hyperextend your wrist just like this, and it can be done like this as well. But we're going to hold this position for 40 to 60 seconds. And we won't do that for the purpose of this video, but if we were to have any numbness or tingling into the palms or pain in that area, that would be a positive test. But are you having any?
No.
No. Okay. Perfect. So moving on to our elbows. We are going to first inspect our elbows. We are inspecting our Allergion processes, and those are nice and equal. They're symmetric. There's no and going back to inspection, there's no discoloration. I don't see any swelling or any nodules present. So going through those processes, I don't palpate any nodules. I don't palpate any crepitus or swelling, or is there any pain?
No.
Okay. And then going on into, I'm going to do one side here. Okay, so palpating our lateral epicondyle right here. If there was any pain in this area, this would indicate a lateral or medial epicondritis, or what we call golfer's elbow. And then on the lateral side, if there was pain or tenderness in this area, that would indicate lateral epicondritis, or what we call tennis elbow. And then while we're here, we can also palpate for the extensor surface of the ulna, which is the point of the elbow, and I don't feel any nodules or any masses or anything like that. Okay, and then kind of going on to our our range of motion. Let's go ahead and do our, so we can do flexation and extension. Okay, very good. And then we're gonna do stick your hands straight out, and we're gonna do subordination and then pronation. Subordination, pronation. Okay. And then you can also do this for your patient as well, just to kind of test their range, see how they feel with their range of motion. Okay, that's very good. Okay, so moving on to our shoulders. First, we're going to inspect our patient's our shoulders anteriorly and posteriorly. We are first noticing symmetry, so her shoulders are nice and symmetric. I don't see that there's one shoulder higher than another shoulder. I don't see any atrophy. And normally we would have our patient in a gown to see this, but we would know if there was any like discoloration, masses, nodules, or anything like that. Palpating, so I'm gonna go on this side so you can see. Okay, so starting at the our sternal notch right here in the middle, we're going to kind of work our way up the clavicular line, and we are palpating for any crepitus, any fluid. Again, like if there's any pain or if there's any warmth or heat, and then we are working our way up to moving our way to the amclerovicular joint, and then to the bicep groove, and then the terminacle of the humerus, and then the coracoid process, and then the subdeltoid process in the back over here. And again, I don't feel any nodules, I don't feel any fluid or swelling, any pain noted in those areas. Okay. And then for our range, let's do our range of motion for our shoulders. We are going to do, so go ahead and stand up for this one. Okay, so a few things. We're going to do our flexation and extension back 60 degrees. So that flexation would be 180 and then 60 degrees. And then you're going to take one arm and you're going to cross it over and hold it with your other. This is our abduction. And then out. Sorry, you can hit me if you want. And then do it with your other arm. Hold your hand over the line of your body, 90 degrees. And then out. Okay, perfect. And then what we're going to do is take your arm and you're going to what we call externally rotate that shoulder. So touch your hand to the very back. Perfect. And then the other side. So this is externally rotating that shoulder. And then now we're going to take our hand and we're going to internally rotate our shoulder right here, and with the other arm, internally rotate it to that side. Okay, so any pain while we do any of this? Okay, and then this next test for testing if we're having any issues with our rotator cuff is the empty can test. So you're gonna stick your hand straight out, and then you're gonna pretend like you have like cans in your hands.
Okay.
And then we're just going to empty them. Okay, any pain or anything in your shoulders? Okay, and then since that's a negative, then there's no issues with her rotator cuffs. Okay, go ahead and, okay, shoulders and okay, let's move on to our head and neck. So while she's in this position, we are noticing, we're going to do our head and neck. We're noticing symmetry, if there's any atrophy, if there's any nodules, discoloration. We are noticing her posture, how she's standing upright. And then her spine, we can go move to the back. Okay. We are noticing, we can start to notice like her spine and the curvature of her spine. And then what I'm going to go ahead and do is I'm going to put my hands on the back of your right here. And this is our TMJ, which is our temporal mandibular joint. So go ahead and open your mouth and then move your jaw side to side. Do you have any pain?
Mm-mm.
Nope? Okay. And then as I'm doing this, I'm feeling for any crepitus, any fluid, any nodules, and then go ahead and turn straight. Another test that we can do to test for maximum mouth opening, you don't have to do this, but is we would have the patient take their 3 fingers and vertically put the fingers into the patient's mouth to test, see how far the patient can actually open their mouth. Okay, neck. Okay, so and then while we palpate too, we can also palpate the like the cervical, like our cervical spine while we're here. There we go. Our cervical spine into our paracervical spine too, into our trapezoids, and then our rhomboids as well. Okay, that's good. And then the next thing we can do for our specialty test for the head and neck is our Sperling's test. So with that, what I'm going to have you do is with your neck, you're going to extend your neck back, and then we're going to kind of move your head side to side, and then a little pressure. Can you push against it? Okay, and then again on this side and push against. Any pain? Nope. Okay. So that would be a negative test for our cervical spine compression. Okay. Okay, so have you turned back this way. A lot of movement. Okay, so next we're going to move on to the spine again. So first we're noticing the S curvature of the spine, and we are noticing, so we have the S starting in the cervical and then kind of being rounded out, and then concave right here into the sacral joint right in here, which I see nice, and you can follow the vertebrae down. Okay, I'm thinking. Don't. Curvature of the spine. Okay, so from here, what we can do is we're going to kind of locate our iliac spine. There are our crest right in here. So I'm going to have you lean forward, okay? And is that as far as you can go? As far as you can. Okay, that's perfect right there. Okay. And noticing that the hips are nice and even. There's no like difference in movement with her hips. And then come back. And then now you're going to lean back towards me. Okay, good. And then back to center. And then, so I'm going to have you turn here. And now what I'm going to have you do is you can kind of move side to side right here. Abdominal, lateral. And then we are going to twist our spine, twist, and twist. Okay. And then that is our, I'm thinking internal twist. Yeah, okay. So a few tests that we can do for that is a straight leg test, but we'll do that when we do the hips, which we'll move right into that. And then another thing that we can note too is the creases where the buttocks reach, that it's nice and equal, and that our iliac crest again is equal to kind of like our shoulder dimension here. Okay, a lot of things for the spine. And then back around, sorry. There's so much to the spine. Okay, so what we want to do is we're also, like I said before, we're going to palpate the spinous process and the vertebral spaces in between. And then if the patient has had any like vertebrae fractures of the vertebrae, we can, using our ulnar surface of our fist, place it here and kind of palpate down, percuss down the patient's spine. And then is there any pain as I go down, Mackenzie?
No.
Okay. Okay. Okay, perfect. Lots of things I told you. Okay, so okay, now let's go into the hips. So again, noticing her posture and her hip location, to her shoulders, inspecting any like disc deformities. Like if she had the gown off, we would notice if there was any discoloration, and noticing any atrophy. So then we would go and like again palpate the iliac crest right here, anteriorly, and then for our range of motion, okay, we'll go ahead and have you lay on the bed here.
All the way back?
Yeah, so head on the pillow there. Okay, make sure my video frame is good. Okay, so for our range of motion, we have a few things that we can do. We are going to do our flexation. Go ahead and we'll do the straight leg test just because this is easier. Okay, go ahead and lift this leg up. Okay, and what this is going to notice if there's any like herniated discs or anything, and then up again. Okay, and then I want you to do it by yourself this time. Any pain or discomfort?
Nope.
Okay, and then let's go ahead. Okay, let's do a few things here for testing our specialty tests for the spine. I'm not in view. Sorry. Okay, so the straight leg test, flexation. Okay, so a few tests that we can do to test is the Faber's or Patrick's test. So I'm going to have you take this leg and we're going to make a 4. I'm going to put some pressure right here. Does that hurt? Okay, no. And then over here. And what this Faber's test is testing for is if there's any hip or SI joint disease. And then our Thomas one, we're going to bring our knee all the way to our chest here. And we're listening to see if this leg lifts up, which it does not. Any pain?
Nope.
Okay, discomfort? No?
Nope.
Okay, up. Okay, perfect. Okay, and then a few other things that we can do are go onto your back, or onto your belly, sorry. Yeah. Short little thing, we're going to do our abduction and abduction. Go ahead and lift this leg up. Okay, and again.
No.
Okay, yep, perfect. And then back to your back. Any pain or discomfort?
Nope.
And usually those are 30 to 60 degrees. Perfect. Okay, so moving on. Now we can kind of do our knee here so you can kind of see. Sorry. Okay, so with our knee first, I mean, usually the patient would have nothing on her leggings, or no leggings here, but we're noticing obviously skin, bony prematurers, if there's any deformities, any nodules, any discoloration, swelling, which I don't see anything for her. And then we're going to be palpating her knee. We can feel for the suprapatellar pouch, okay? And then into the sides of the patella. Kind of move the patella around, both sides. And while we're feeling for this, we're feeling for any crepitus, any swelling, any warmth or heat, any fluid kind of being moved around, asking if the patient's having any pain or discomfort during the procedure. And then lastly, we'll feel for the popliteal fossa right here, and that's, we're feeling if there's any Baker's cysts, which I don't feel any for her. And then for the range of motion, we have a few things we're gonna do. Okay, so we have a few tests that we are going to do. Which first one is the Varus stress test, which is I'm going to put my hand on the inner part and outer part of her knee and push in, And what this is testing for if there's any meniscus or like ACL or meniscus tears in here. So if I put pressure on here, is there any pain in here? And then we would do this on the other leg as well, but vice versa, we can test for the valgus stress, which is I basically just alternate my hands and then I push out. Nope, okay. Another test that we can do is the Lynchman's. Lynchman's is, I'm gonna hold this knee and shake. Any pain in that knee? Nope. Okay. And then the drawer test, which is gonna test for ACLS or PCLS. So I'm gonna have her patient bend her knee. And I'm basically grabbing this by the popliteal fossa, and I'm kind of pulling and pushing into her knee. Okay, any pain? Okay, then we can do this leg too. Okay, nope, okay. And there's no crepitus or warmth or anything while I'm doing these tests as well. Okay, another test that we can do is the McMurray's, and that one is okay. As you're gonna lift your leg, and kind of doing it's a combination of the valgus and the stress and the varus stress test. But I'm gonna bend the leg and kind of put pressure on there. No, okay. No, okay, and vice versa. Okay, perfect. Okay, so that's for our knee. Lots of things to do. And then a lot of these tests too, we're testing for what are they called? Just like the tightness of the knee, like if there's any movement in the knee. Which when we did hers, I did not feel any of this test. Okay, and then next we're gonna move on to the ankles. So having the patient here, let's kind of have you sit. I guess like yep. Okay, sorry, a lot of movement in this video. Okay, so as far as we're going to look at the ankles. Again, we're inspecting for any discoloration, any nodules, any atrophy or anything like that, which we don't see anything. For a range of we're palpating, there's no crepitus, there's no swelling, there's no nodules. And then as for a range of motion for our ankle, we are doing our ankle flexation and extension, and we can do inversion, so heel to your calf and then back, and then abduction, adduction. Okay, and the same for our other foot, abduction, adduction, and then you can have the patient do it yourself. The active or passive range of motion. Okay, perfect. And then moving on to our feet and our toes. So when we're inspecting our feet and our toes, we are first looking for any atrophy, any discoloration, any swelling, which I don't see any in both of her feet. The only thing that's different with this is we're also looking at our feet, so we're looking at if there's any corns, callus, bunions, or any plantar fasciitis. So Mackenzie, let me just have you come to the ground really quick and put your foot flat to the ground, and we're noticing if there's any plantar fasciitis. Okay. Which is a flat foot effect for her. And then for palpation, again, with palpating distal to proximal with those interphalangeal joints, so distal and then proximal into the metatarsals. I'm not feeling any nodules or crepitus or swelling or pain or warmth. Okay, awesome. And then that is... Oh, and then also I'm feeling for if there's any Morton's neuroma, which is like a growth of tissue around like the toes that can be discomforted for the patient. Okay, that's it for our musculoskeletal exam. Thank you.